Good morning. We'll call meeting to order at 9:36. First order of business is approval of minutes. Did everyone get the minutes and review them? Are there any additions or corrections? If not, is there a motion to approve?
I move.
A second?
Second.
All in favor?
Thank you. Aye.
Aye.
Any abstentions or nays?
I'll abstain since I was there.
Okay. The minutes are approved. The motion is approved. We don't have any public appearances today. As far as the agenda items, the first item is the review of the patient advocate program.
All right, so I'm going to bring up this training video. So if you recall, we lost the grant to do the patient advocacy program.
Mm-hmm.
But we connected with Edgewood student nurses, 3rd and 4th year. And so we've started working with them as of the end of the month.
Is this on?
Yeah, it should.
I thought the speaker was
The
in the way.
speaker thing gonna be in the
The
way?
speaker's in the way here.
Oh, thanks, guys.
And the laptop as well?
All right, let's see. Yeah, let's pull that over there. And let me pull that.
There you go.
And let me see the source here. Hopefully, because it worked a second ago. There we go. So I'm going to show you a training video that, thanks to Fact TV, who is awesome, Amy and Sarah, it was really the brainchild of Amy to do a training video to really educate the nurses about what we need them to do.
Excellent.
And then one of our clients is in the video as well. So I just wanted to share this with you. It's about 12 minutes.
Our Patient Advocate Program. The goal of our program is to assist older adults in navigating the healthcare system and to empower them to be self-advocates.
Yeah.
What is a patient advocate? A patient advocate helps people navigate the healthcare system through empowerment and education. They do this by listening to the patient's healthcare goals and wishes and partnering with them to ensure these are respected. A patient advocate collaborates with the healthcare team and family members and acts as a liaison as needed. They guide and coach patients, ensuring they have all of the information necessary to make informed decisions. Patient advocates help patients take back control of their own health care by reminding them that they are the ones in charge and that they always have choices. Here are some recommended best practices. The first recommendation is to be patient-centered. Ensure the patient's goals and wishes are known. Respect each patient's individuality and choices. The second recommendation is for informed decision-making. Confirm the patient understands the aspects of all options. Provide clarification as needed in simple language. Affirm the patient knows they always have choices. The third recommendation is empowerment. Do not do for the patient what they can do for themselves. The fourth recommendation is to educate. Encourage the patient to ask questions. Facilitate obtaining relevant information and discuss reliable sources. Lastly, coach and guide the patient. Do not make recommendations or decisions for the patient. Model effective communication with the patient and providers. What happens without a patient advocate? This is Mary. Mary is a participant of the Fitchburg Senior Center. Mary's medical history includes high blood pressure and diabetes. She currently takes multiple prescribed medications and is currently having difficulty with medication management. Mary's visit today is a routine appointment that was scheduled 3 months ago. Some of the concerns are dizziness, a recent fall, medication management, and nutrition.
Hi Mary, how are you?
Hi doctor, I'm fine. How are you?
I'm good, thank you. So how are you doing?
Pretty good.
Good. How about your meds? Have you been taking those
Oh
regularly?
yes.
Good. Any changes when you're taking your meds?
No.
None. Okay, I'm just looking over your med list here. You had told the tech that you have been dizzy. I thought I'd take a listen to your heart. So what's been going on with that?
When I walk too much and do many things, I get a little dizzy.
Mm-hmm. Well, you might have to follow up on that at some point. But I think that for now we might just make some adjustments to your medications. And what about your blood sugars?
Pretty good.
Have you been recording those?
Mhm.
Any changes with your meds for your blood pressure?
No.
None, and none for the blood sugar either?
No.
Okay. Well, is there anything else you might wanna ask me?
No.
Okay. Well, you have a good day, and we will follow up soon, about the increase to your meds, okay?
Okay,
All
thank you,
right.
doctor.
Thanks.
You're welcome.
You can print out an after summary at the desk.
Okay.
Okay, bye-bye.
You've just seen what can happen without a patient advocate. Here are a few key takeaways. During the visit, the doctor asked several questions of Mary. Her response to most of those questions was no, effectively closing the door on any type of discussion. For example, Mary was hesitant to bring up the fact that she had fallen at home recently. Now Mary has a change in her medications, which may prove to be unnecessary. As you can see, the main concerns Mary brought to this appointment were not addressed. Now let's take a look at what happens with a patient advocate.
So Mary, before the doctor comes in, I think it would be good that we make sure we can write down all of your questions or concerns. Can you think of anything off the top of your head that you wanna make sure to share with the doctor today that you're concerned about, or, no? When we talked last week, just to kind of touch base and see how you were doing before this appointment, you had mentioned that you've been having a little bit of dizziness. And that you had a little fall. You said it was kind of a slide off the chair, and you know, you didn't really seem to hit your head or hurt anything. But have you noticed a little bit of dizziness since then?
Yes.
Okay, so maybe we should ask her about that. Is that all right if we mention that?
Yes.
Okay. The other thing you mentioned last week is you hadn't been feeling well, so you didn't make it to the center. And I know you usually lunch there,
Yes.
so how are the meals and the menu at home? Do you really rely on that meal at the center? It's kind of hard for you to get meals together at home if you're not there?
Yes.
Okay, so that could be maybe affecting your blood sugars a little bit or something recently, okay. And you mentioned to me, I guess the one concern I have that I think it's important we should maybe bring up with the doctor is that at times you've been finding a couple pills in different places throughout your house. And I know you've been really good about being able to, you know, keep track of your meds. Sometimes that can get to be a lot. But perhaps you're forgetting some here and there a little bit lately.
Could be.
Okay. Okay. Is it all right if we bring all these things up? I think they might all be pretty important for her to know.
Yes.
Okay.
Well, hello, Mary.
Hello, doctor.
Hi, nice to see you, and who do you have with you today?
A patient advocate, Dawn.
Oh, hi, Dawn, nice
Hi,
to meet you,
nice to
I'm
meet
Dr.
you.
Amy.
Hi, Dr. Amy.
So, how are you doing today, Mary?
I'm doing fine.
Good. How have you been taking your meds?
I take them all the time.
And it's been going well for you?
Yes.
Okay,
Excuse me, Mary. One thing that we had talked about, is that right? You remember how before she came in, we were talking about finding a couple pills sitting around?
Yes.
Did you wanna?
Yes, I dropped some of my pills.
so let me ask you a question. How do you take your meds? Are they packaged in a box? Do you get them delivered? Are they all in the bottles?
They're in the paper.
They're in paper?
And they tear off when you want morning or night.
Okay. And are they dated?
Yes.
And they're packaged like that from the pharmacy?
Yes, they are.
Yeah. Sometimes it's easier for people to have pills in a med box that you don't have to punch out the pills, then you're not losing them.
These
Is
are-
that what's happening?
No, they're in a paper. There's so many in each section. You tear them open and then you take them.
Have you ever thought about using a pill box? That might be something that you might wanna try in the future.
Okay.
Okay.
That's
Great.
something I could help you get set up with.
Does that sound like a good plan for the meds?
Okay.
Yeah, then you might not be dropping them on the floor or finding them in other places.
That's true.
It's important that everybody takes their meds as prescribed,
Oh, yes.
so. I did see that you told, the med tech that you might have been dizzy.
Yes.
And, okay, well, we might have to just adjust your meds for that.
Mary, before doctor came in, you had, you had mentioned that you had a little fall last week and that you felt a little dizzy since then. I think that might be important for her to know
That's
about.
very true.
Do you wanna tell me about that episode?
I had a small fall. I fell off of the chair. I didn't hurt anything.
Were you, sitting and then you were standing and you fell, or were you walking and then you fell by the chair?
I was sitting and I fell.
Okay.
I didn't hurt anything.
Well, that's a really big risk factor for people taking some of your medications, so I think it's something that we should probably look at. Maybe getting some labs drawn just to make sure, you know, her blood sugar and the blood pressure is all doing really well. And then of course we can check you out after we're done talking just to make sure that you're doing okay.
And I have plenty of time for that today. If we need to stay for to go to the lab or to
Yeah, you can
hang
stay
around.
for the
Yeah,
lab?
I can
Okay.
stay for that today.
Okay, I
if
would
we
like
need
to
do
run
that.
some of those tests. Have there been any changes with your blood sugar, and the numbers have been pretty good?
Yes,
Okay. And you've been eating well?
I do fine.
Okay. Because sometimes appetite and eating can change your blood sugar and not make you feel so well. So,
Do you remember what we talked about last week and what happened last week when you didn't make it to the central all week and you said your health was a little bit off with your blood sugar?
That's why.
yeah, you were staying home because you weren't feeling well because of your blood sugar?
Yes.
Okay, that would probably be another lab that we would wanna run, and I can write up an order for that. Send that down, so that might just take a few minutes after your visit today. All right, well, is there anything else you wanted to ask me? No? Anything you wanted to add in?
When did you wanna see her back then?
I wanted to, well, I think we'll check back in about a month to go over her blood sugars. I also wanna know if you've had any more falls. The senior center can refer you for a falls, assessment to make sure that there are things inside the home, a home safety assessment to make sure that you're safe. So maybe that might be something you wanna connect with at the senior center or to have one of the social workers get her connected
Sure,
with that.
yeah, I know Amy and Sarah quite well, so
Right.
I'd be happy to reach out to them.
Sounds good. Well, it's been nice, great service. Nice seeing you again,
Nice
Mary.
seeing you,
Nice
Doctor.
to meet
Nice
you.
to meet you,
All
Doctor.
right. Take
Thank
care.
you.
Bye-bye.
Bye-bye.
Now you've seen what can happen with a patient advocate. Here are a few key takeaways. They reviewed concerns before the doctor came into the office. The patient advocate took notes to be used during the visit. The patient advocate ensured that the patient's needs were met during the visit. Mary's concerns were effectively met, thus changing the direction of the appointment altogether. As you can see, what happens without a patient advocate can vary significantly versus what happens with a patient advocate. By following the recommended best practices, you as a patient advocate will be playing a crucial role in an older adult's healthcare journey.
Very well done.
Isn't that wonderful?
Yes, it is.
I know.
And I can see my mother not answering any questions.
A lot of us.
She had 5 brothers that were doctors, and she had this aura of doctors.
Uh-huh.
And she just was as nice as she could be.
Right.
There.
You don't want to bother them. You don't want to take their
Right,
time.
right, yes.
You know. Yeah. So I'm so excited about the program, and thanks to Fact TV because they did such a great job. They filmed it at Edgewood because they have sort of a clinic setup situation, and the script is great, and I'm such a visual learner too. So to me, I felt like it really explained the benefits of that program. And so right now we have about 14 students. 8 of them are 7 or 8 are accelerated, so it's more of an 8-week program for them for this session, and then the rest of them are just in the non-accelerated program. So we'll have a little more turnover with that accelerated program, but they are all partnered with one or two clients, and it's been a lot of work for the social workers, communication and trying to get schedules. These students' schedules are so varied, and then trying to get doctor's appointments lined up on the days the students are available. But I think that it's going to fall into a nice routine. And then we've also connected the Edgewood students because they have to get so many practical hours in, and we didn't know if we could fill them all with just doctor appointments because not every client goes to the doctor every week. They'll be doing blood pressure checks at both McKee Park and Chapel Valley Apartments on Thursdays, and maybe doing some health education presentations and that sort of thing. So it's really exciting and a great program.
Why did we lose the money?
Bader, it was Bader Philanthropies. They just said we just had a lot of grant requests, and we just couldn't fund this one. Not that they didn't like the idea. I could go probably back to the county, but you don't really see a lot of grants fund reoccurring programs. You have to prove that you can be self-sufficient. The Friends, we are working with the Friends. There are some clients that do have really complicated medical needs, and we are working with the Friends who have allocated a set amount of funding that we can use. So Dawn is one of our patient advocates. She is the certified patient advocate through UW, and then we're still working with the nurse that if the situation requires it, we can still hire them to work with a couple clients that have needs that are above and beyond what the nursing students can really handle, and offer that support to a couple of our clients. So far so good.
How are the students evaluated in this?
So there's a lot of communication going back and forth between both of the instructors from Edgewood College. We don't really see their curriculum. We're just giving the instructor feedback. So I can't say. It's just the feedback that we give them. We get feedback from the clients, how the appointments went. The students have particular forms that they need to fill out and give us feedback about how it went. So it's just a lot of sharing of information. And certainly this is new for them. It's kind of new for us. It's wonderful that the instructors aren't over the top, like rigid, and they're like, look, we're just gonna work this through, but they love the experience that they're getting.
Yeah.
So.
Do they have anything like you got your phone that they could record the meeting and then be able to critique it?
Possibly, but again, I'm leaving that up to the instructors.
Okay.
Is on our end, all we want is to know is that they're advocating on the behalf of the client, that they're they are able to go and do home visits, which is nice, so they can see them in their environment and then talk about their needs, and then that feedback that we get, if we felt like there wasn't good feedback or a client said something, maybe we would talk about recording. But if they needed that intensive feedback, I'm going to leave that up to the instructor.
Yeah.
We're just going to go on the client and the information we get back from the student. So
It's since you can't be in the
Right.
visit with them.
Right. Well, and every student, Amy or Sarah, when they connect the client with the student, they're always there for that initial meeting. So they then also can assess, like, is this client going to be timid? Student. Some are a little bit more outgoing, some are a little quieter. So then they can get a sense of, okay, maybe we need to say, okay, make sure you're asking the right questions and that kind of. So, so it's not what it was where we have these really experienced nurses and patient advocates, but I think it's the next best thing. And again, when those medical situations really require a paid advocate, the Friends have offered to, they agreed to support.
That's good to know, yeah.
The Friends they're the best friends ever. But I also don't, I want to be real conscious about how we use those monies, so we're limiting the number of hours that we would allocate to a certain client, because who wouldn't want a nurse all the time for every single visit, and that might not be necessary. And so we want to make sure that we're being good, using the money wisely, and if a visit isn't that critical and it's just, something real casual, then we're gonna send a student nurse, and when it's more complicated, then we're gonna pay an advocate. So we're gonna try to strike that balance. So.
And as far as, I'm just adding on to that, as far as meeting the general demand for this service, are 14 students being able to work with 1 or 2
Absolutely.
clients, that's enough for now?
Yep. And it really, working with the students, opened it up even more, because when we had the grant money, we tried to focus on just lower income, because oftentimes the grants like to fund that. But now we're just helping whoever needs help, because income doesn't necessarily, it doesn't really define if you need help or not. People can have all the money in the world and not have anybody here, or just, need that support, so.
So they are able to go with the, to the doctor visits?
Correct, they do not transport, so we're doing the rides through RSVP, because we're not asking the students to transport, that's a liability issue, so they'll go through RSVP for rides, and then they meet them there.
Okay,
So-
but they're there, that's the important thing.
Correct, they're there, and they meet with them beforehand, whether it's face-to-face again or on the phone, to go over what are their needs, what do we want to address, and, and then the feedback of what did the doctors say, and then sharing that with the social workers, so we just have a nice continuum of care from them all the way back when they get home.
Do the patients sign a release for this?
So, yes, they sign a release to talk to our nurses, and then through the hospital, they would then sign a release for the hospital. If the hospital wants to talk to the nurse separately, or the social worker, then we have to get a release from them, from the hospital's release, but yeah. So, yeah.
But you don't need a release for the student.
The student, we have a release for the student. The clients allows the student to talk on their behalf. So yes, we do get a
You have
release
a
from
release
the,
for that.
yeah, that the client can hear this confidential
What's
information.
the total cost of the program then?
None,
None at all?
no, because the
What-
students
will
are
they
free.
get money for the friends?
Because in the complicated situations, we have a couple clients that their needs are so high and so complicated that we will then go back to the paid advocates, either Dawn or Nancy or a nurse, and pay them. So the friends, I think we allocated up to $200 a month through the end of the year, and we'll see how that goes, and we'll reevaluate. So, the friends are gonna support the program if needed, but the whole program with the Edgewood students, there is no cost. I mean, there was some making of forms and the brochures and stuff, but there's technically no cost. That makes sense? Yeah.
Well, the video was excellent.
I know,
Yeah,
I love it.
It was really good.
I know.
And I think Mary is probably pretty typical.
Very.
Yeah.
She was a perfect.
Yes.
She didn't even rehearse. I was like, that is exactly how it goes. Like, it was great. So yeah, she did a great job, and I just don't.
Well, and she minimizes the fall.
Right.
and,
Because
that's,
it's
I
not a
can
big
see that.
deal.
Yeah.
But when a doctor comes in and they're busy, and even us, you don't want to bother them with the little things, and so that patient advocate can say, no, this is important. Yeah. So I'm really excited about it. I'm really proud of Amy and Sarah for coming up with that, and so it's all good.
Yeah, great.
Yeah. All right.
Okay, next is a report from the Senior Center Friends.
That's
Not
you.
me.
Yeah. Not me.
Well, we are in the midst of planning for the what has become an annual event, but maybe this might be its last year. The pancake breakfast, and it's scheduled. I think it's April 24th.
24th or 26th.
20,
Yeah.
It might be the.
Wait, yeah,
the week
take a
of
peek.
that.
26.
It'll be the Sunday.
Yeah, 26th.
26.
I got it down.
Okay.
Wow, I like
Are you
that, Al.
impressed?
Nice. It's on her calendar.
Better put that in my brain being on that
May I
chair.
ask why this might be the last? Just too much
Well,
work?
it's a lot of work, and we just, I don't know, I'm chairing it this year, and I just think we kind of need to, mix it up a little bit. The attendance was down last year. We had raised the prices a little bit, and really increase in the prices. I don't know whether that was the reason we didn't have as many people. The weather was good and all of this, but we weren't disappointed with the crowd because actually it was the size of the crowd we could probably manage better. And we did come away with a nice amount of money for the senior center. But we just figured like we should mix it up a little maybe. That's my view.
Yeah, that's the view of it. So it was hard to find a chairperson this time, but it is a lot of work.
Right.
I think the year before we were close to 600 people,
Yeah.
which is it's
That was
just
too much.
unmanageable. That's just too many, and I feel like because people were standing in line so long, maybe they didn't come back because it was they had to go get more food. That's a lot of people. So then we went back down to what 450, 425.
Yeah.
That's still a ton of people.
Yeah.
That's a ton of pancakes, and so
Right.
I have mixed feelings because it is a lot of work. But it's such a wonderful community event, so whatever they do, and we'll work together to replace it with another community
We
event.
would do some kind of an event.
Yeah.
Or we can let community know if they want senior center to continue, they should pile on and help with it.
Well, it's not even
Even from
that. It's like
outside
how
the-
many grills can you hook up and extension cords because you have to crank out so many pancakes. You know what I mean?
Yeah.
So it's we don't have the facility to handle that capacity. It just because it's just hard. It's hard to set up and try to accommodate that many people. I think our help is fine.
Yeah.
We do have a lot of help, but
Right.
trying to make that many pancakes. If everybody's getting 2 pancakes, that's 1,200 pancakes, 1,500 pancakes, on 4 little griddles back there. So,
No, actually, we have
Maybe they could
Yeah.
set up in the hallway.
yeah.
At
We looked
summer
at
camp, we had
we looked at
the round
getting
thing.
we looked at getting one of those, but I can't remember what the reason was. We looked at doing it up in the Oak Hall room, but my God, then we're setting up 600 chairs and tables, and so anyway, you just got to weigh it out.
Yeah.
It might be interesting to see if one of those big griddles could be rented.
We did. I think it was because it was with propane. We talked to maintenance, and they're like, "You can't have that in here," because they run with a propane tank or something. We did look into it,
Okay.
but
Yeah.
I'm not certain what.
We have people that bring their griddles in from home.
Yeah,
Yeah,
yeah.
so we end up with 8 or 9 griddles.
Yeah,
going
but we
there
got
at a time.
extension cords all over the place.
Yeah, right.
Falling hazard.
Oh, yeah, fire hazard.
Uh-huh.
So anyway,
Yeah.
yeah.
But anyhow, it's on board and
Yeah.
We'll have it. I thought the program that the senior center did for their anniversary.
Oh, yeah, with the
the
food
nanny.
carts and stuff, yeah.
I thought that
Yeah.
was a very nice event, and
Mhm.
so I'm kind of leaning towards maybe next year doing something.
Did we
more
make
like
money
that.
on that?
No, that
No, it
was
was
to
that-
bring the people in. To
Right,
sit and
yeah, that's what I thought.
Yeah,
We
yeah.
paid for that. but-
Yes, it was very nice though, I admit.
It was.
But I think you could make it something like that
Yeah.
into an alternative,
Mhm.
if necessary.
Yeah.
Is there any history of like a pie and ice cream kind of social or?
No, we
Something
did a
like
pig
that.
roast for years. I mean, going way back, once we did a spaghetti dinner for a couple years, but no,
There's the ice cream thing at the Apple.
Oh, they do the Apple Garden ice cream, yeah, for a
Mhm.
fundraiser, yeah.
Yeah.
But yeah, any ideas are good ideas, it is fun to change it up sometimes too, but.
We have we do have a couple of other ways that we bring in money, and we're always kind of looking for ways to bring the money.
Yeah.
So that's kind of the big thing that we're working on right now.
You guys allocated up to $1,000. We're gonna get some more seating up by the front because we have a lot of people that wait for the bus when they come for lunch and go home because the bus has to make 2 trips, and so people are sitting out there for 45 minutes or so if they're on the second route. Even though there's tons of seating in the lounge or in the dining room, people like to sit by the door, and it's always been like that. And so we've started to pull out just some, regular chairs. So the Friends have agreed to pay for a couple nice commercial, nice seating chairs for folks out there. So thank you for that, as well as some entertainment coming. You guys are paying for that. We've got Virgil coming tomorrow. We've got the Norwegian dancers coming March 4th, and then we have on St. Patrick's Day It's a duo from a band called the Westies, and it's a mandolin and a fiddle. So that should be really fun. So
Has the piano arrived?
yeah, they love it. Yeah.
Is that the black one that's in the?
No,
No.
it's tucked away in the closet up on the upper
Okay,
level, so
okay.
they just can use it for their practice. And now we don't have to haul them up and down.
Okay.
So it's great. Yeah, it's really nice.
Judy, if I might throw in on travel.
Oh,
Last
yeah.
year, the Friends Travel Committee sponsored a trip to New England, a fall New England trip. There were 23 people on it, and everybody was so excited. They all came back and they were talking it up and whoop-de-doo, and this was really great and that was great. And so they decided to run it again this year.
Okay.
And there's 18 for sure already. And
Really?
it looks like there might be 3 more too.
Wow.
So.
And Jim knows this. Why?
Well, my wife is on the committee.
That's right.
It's first-hand information.
Yeah, right. He's not just making that up. Yeah, that's
But
awesome.
I thought that was pretty neat to do the same trip 2 years in a row and have that
Yeah.
kind of turnout. Wow.
It was very well received. A number of different people talked about it,
Yeah.
and so it was a successful trip, and obviously.
And that's where a lot of the money
Yes.
is made for the
Yeah.
Friends too, through the travel
Yeah.
program, so.
We just had the travel show
Oh,
recently.
yeah, right.
And so the new trips for next year are posted in the
Mhm.
senior center, and there's brochures and everything if anybody wants to, feel free to come.
And
along.
what do you have, about 40 people there? I think Kathy
Yeah.
said?
Something like that.
Yeah, looking at the 2020 trips, so that's great.
Yeah, very good.
Yeah.
It's really, it's been for a number of years, it's been one of our best money makers.
Oh, yeah.
The travel program.
Yeah.
Notice there's more people doing travel things, like on
It ebbs and flows, I'll tell you.
television, people doing travel.
Mhm.
But, yeah, it's a good program.
Right.
I think we got a new member.
Oh, right.
Don't ask me her name. I'm sorry,
Should she start
I
yet?
didn't come prepared here.
I haven't met her either.
Yeah, so I think that fills up the board now.
Yeah.
We have, so we're ready to roll.
Great. Okay.
Don, a report from the Area Agency on Aging?
No actual items this last month. We just met last week, and we reviewed grants that had been won in the past, and they reported on what they'd done with the money and how the programs had gone, but nothing in particular.
Successful programs?
Yes. One was with Newbridge, so how they were doing the supplemental food program, and the other was a group of case managers from various sites went to a bereavement conference in La Crosse. An international bereavement conference.
Right.
In La Crosse.
So yeah.
There is something humorous about that. But they reported there were people from Canada, so.
Okay.
When I saw that, I was like, is the county paying for them to go overseas? Like, I didn't know we could apply for that. Yeah, and then the other one is that River Food Pantry. It's like they're doing a delivery,
Newbridge,
right?
the Newbridge program.
Right. They're working with River
For
Food.
people who don't have food for the weekends.
Right.
They're bringing supplemental food to them.
Right, so they're delivering it to them.
Their goal was to serve 30 families. They served 34 families. Now they're moving on to 60
Yeah.
families for this year. So
Yeah.
that's their goal.
Yeah.
So which tells us there's tremendous need out there.
Sure.
I wonder if something like that couldn't be arranged through Badger Prairie Needs Network
Yeah.
for this side of town.
Mm-hmm. Yeah. I'll put it on my list to do-dos. Yeah. Okay.
Thank you. Jill, report from the director?
Okay, so a couple things. Can you decide if I want to do the heavy stuff first or the light stuff? I think I'll do, so we have a code of conduct that I'm going to pass around that the commission approved back in 2013. I'm going to share that with you guys. We had an incident recently where a participant verbally and physically attacked, went after one of our instructors. And without sharing a ton of detail, because there's a lot of it, it just made me pause about our code of conduct. There's some cognitive issues with this individual, and the individual was kind of provoked by the spouse, who was saying some things that when the instructor commented back, the individual didn't like how the instructor was talking to his spouse, and so then it made him sort of agitated, and then he proceeded to go after the instructor. So we've met with them, we've met with the police, we've done a lot of discussions about this. And I looked at our code of conduct, and I'm just struggling a little bit because I jumped right down to number 3. And I suspended the folks right away and said, you can't come back for 2 weeks because, this is what happened. And you can never come back on the day this instructor teaches class. You can never participate.
Thank you.
on
I'm
that
glad
day.
to hear that.
But I'm also, weighing the idea that maybe that's a permanent ban. I don't know. I'm really struggling because there was some cognitive issues. The empathetic side of me said that everybody deserves a second chance. But on the flip side, because there's these issues that I don't think are going to go away and maybe over time get worse, maybe a permanent ban is necessary when someone physically attacks somebody. And so I had just, and I've gotten a lot of feedback from people in the class that witnessed it. I've gotten feedback from people that heard about it and what we should do. And so I'm bringing it to you today to think about, to look at that code of conduct. We don't have to make a decision. I want to bring it back next month to either say we're going to stick with this one or, and I'd like to have a little bit of a discussion today, but it's not an easy answer. And I think the more we discuss it, the better our answer will be, because I'll have a lot of input. So,
Well, I think that sometimes there's something happens and it's not reported to you.
yes,
It might have been a minor at the first time.
absolutely.
And that's what I understand is happening there, that the remarks were made, but nobody reported it.
Right.
And if you don't know,
Right.
you can't be blamed.
Right, and that was, and that was discussed too,
Yeah.
and that's just, if people can just let me know, as minor as it is, there's your paper trail, I need to start to document.
Right.
So I had no idea, and then this came, so go ahead, Don.
What jumped out at me immediately is having been an arbitrator in industry, the idea of progressive discipline.
Uh-huh.
And that appears what this is.
Mhm.
However, you didn't go through that. So I think you need something in here that allows you to
Yeah.
do that.
Good, right, because I took it upon myself to jump down there because it was.
Right.
I don't
it
have a
was-
problem with that,
Right.
but from a written perspective,
Yes.
I think it is something that we need to incorporate.
I
It
love
gives
that.
you that right.
Something that for severe violations, it's
Or,
Yeah.
or the circumstantial at the discretion of
right,
the director.
discretion,
Uh-huh,
right, exactly.
I like that.
Yeah.
I'm not sure, we have to think through the phrasing, but you
Correct.
know what I mean, the concept.
Right. And that's why I didn't want to, I don't want to approve anything today, but these are the
Mhm.
things that, as we come back in March, you can even send them and I can put them in the draft form. In fact, I would appreciate that if you have thoughts to send it to me so I can create a draft. And then we can look at approving it in March. But I agree, because I felt slightly uncomfortable, but I was like, nobody's going to fight me on that
No.
because, that was,
Severe enough.
it was severe enough to jump down. But you're right, there's nothing in there that says I can do that.
Well, and nobody would ever think that would happen here. I mean, that was
No,
just such a
right.
shock.
I
Yeah.
know.
And I think maybe something that says that it's a requirement of anyone who participates in activities at the senior center that they abide by this code of conduct, that it's stated in here that it's a requirement that to participate, everyone agrees to participate, to abide by the code of conduct.
So, and that's the other issue too. And so we don't have this posted anywhere.
Mhm.
So how do people even know what it is? But we
On the
do now have it posted downstairs because we got a locked bulletin board. It's always been hard to post things downstairs because it's a rental.
Oh.
And we used to have a bulletin board, and then things were up and down, and user groups take things down and decorate it for their birthdays. But now we have a locked one, and so that policy is in there. Now, how I direct people to say, we do have a code of conduct. I didn't know. How do I make everyone aware that this is what the rules are? Besides posting
Particularly
it.
upstairs where you're away from where it's posted.
Right.
To people, but a blanket statement where people register for classes or any activities, that could be incorporated into any registration form
We
or.
don't really have any.
You don't.
And most of the time they just come to Susie or call Susie and say,
Uh-huh.
I'll be sending payment, can you sign me up for this class? But it can be posted at the front desk, it can be posted somewhere upstairs.
Do they sign in each class?
They just check their name off, but yeah, so,
It could
yeah.
be on the sign-in
Yeah.
sheet.
Yeah,
Think of a mechanism.
yeah,
Mhm.
yeah.
How about, right next to where you put your envelope, your pay up
Yeah,
envelopes?
yeah.
Or
Just
even
in a
on the
frame up
pay-up
there.
envelopes?
Yeah.
I noticed that,
Yeah.
have you, where you put down your name and your money and all,
Yep.
what class?
Yeah.
There could be a box.
Right.
Have you reviewed the code of conduct policy?
So we do have a registration envelope that some people use, but not, a lot of people just call in, but I think that's a great idea.
And,
Yeah.
and something that, you wouldn't have to put it on every registration, but failure to abide by the code of conduct could lead to suspension
Mhm.
and or permanent,
That we put
banning.
that in here.
Uh-huh.
Yeah, no, I like
Mhm.
that, yeah.
Because, I think you do need to have that, option to, prevent people from coming back, because even though you've banned this person from coming on days when the instructor's there, there's always the off chance that they could run into one another.
Well, right,
You know, and
right.
it's kind of like a restraining order, isn't it?
kind of.
That they would, and maybe you could put in a thing that, they have a chance to, you could review it in the future, but, doesn't mean you have to readmit someone who's.
Right. In fact, we
been
have somebody
egregious.
right now that we had asked to not come back because of poor hygiene.
Mhm.
And it was really, really a big, big problem. And they came on the bus regularly. So to be enclosed in a bus with the heat on, so what was happening is other people stopped coming because they didn't want to be on the bus with this individual. So this individual is connected with another agency too. So we worked out if you do this, this person had a lot of options to take care of their hygiene. They just chose not to. In fact, they were using our bathroom sometimes to take care of their hygiene when they had accidents, and it was just becoming, you can't do that. And so, we wrote out, here's what you need to do, and then in 30 days we can review, and you are welcome to come back. Well, they don't want to do it. And I feel bad, but I was allowing one person to come at the expense of all these other people that stopped coming. And so we did implement the policy that way with, the review of after 30 days you can come back. But they did not want to adhere to what we had proposed. And it wasn't that stringent, so anyway.
One comment in light of our current society. The second one about brandishing a weapon, the building is posted.
Right.
You don't really need to even threaten with a weapon. If you have a weapon, I don't think that this is strong enough as far as weapons are concerned. I don't know about the rest of you guys, but in schools, if somebody just brings a weapon, doesn't even threaten, and they're out of there.
Well, I think that
a fork can be a weapon too.
Well, right. But I think
So-
with that statement of saying we can jump down and ban, if the circumstances warrant, you know what I mean?
And wouldn't that be up to the police to decide or not, as far as a weapon goes?
I would say if somebody brought a weapon in, they should not come back.
Well, oh, right, but I mean, you
Even if
would
they don't
involve
make
the
a threat.
police.
Correct. Yeah,
Right.
yeah, for sure.
Cause don't you have that there is in here somewhere that you could you would involve the Fitchburg police when necessary.
Yeah, yeah. But again, these are so write your thoughts down so I can incorporate them into a draft and then just send them to me via an email.
Okay.
And then we can continue to discuss. Because it's a good time to look at this policy, for a lot of different things.
I also wrote down the word probation.
Perfect, yeah.
Yeah.
So again, a really unfortunate situation and one I never really thought, in this day, that stuff happens, and so, it's just going to cause us to improve, our code of conduct and hopefully make it safer. I will also bring, and not as involved, but we're doing an emergency protocol for the upper level. It's difficult when participants don't. We're downstairs as a staff, our offices. Do we take the time to go get them? And a lot of folks did not realize that there's a recreation office right next
there.
door.
Mhm.
And so we've developed, I've talked to the rec department to say, you guys are first stop. And I'm going to make everybody aware in that class that if anything happens, they go to your office right away. And you call me, or you know what I mean, if time allows, send them down to me. But if there's an emergency, they have to be the first stop. And so they've agreed to that too. So I'll bring that to you guys. And then we're dealing with one more issue of, what are we calling it? Like a level of being able to participate at the center. So it's addressing some folks that we're seeing that might come in that aren't able to toilet themselves, are disoriented to time and place, and there's no caregiver with them. And so we are also developing a policy that says, you are welcome to come to the senior center. You have to be able to feed yourself, toilet yourself, be oriented to time and place, or bring along a caregiver. And so that will come to you guys as well.
Who would have thought
It's
that you would need to
happened-
do that?
It's happened before.
Oh my gosh.
And so this time I want to make policy. Yeah.
How do they get here?
Cab.
Oh.
Somebody drops them off. It's a group home right now that we're working with that would like their individuals to come for lunch, which I can't tell anyone they can't come for lunch. There's also some issues when people are in a group home and they're on family care. Part of what they get at that group home are meals, and so there's been some big discussions right now because the group home is coming and having meals and not donating or paying for them.
But charging at the group home.
But they're also getting charged at the group home for meals, so I had to go to Dane County to say, can we bill them? And so it's kind of opened up this can of worms, because in the state policy for the nutrition program, if you are paying to live in a group home or assisted living, the cost of your meals is paid for at that group home. And so if you come to a dining site, a nutrition site that's run by the state or funded by Older Americans Act, you have to pay full price. It's not a donation. And so it's been very troublesome right now. And so now the group home is saying, well, we're just going to send them. I said, if you can provide me with a statement that says you will eliminate the cost of their lunch, of their monthly expenses at the group home, then they can come and make a donation to the senior center. But if you're charging them for their meals at the group home,
Which they're not getting at the group home.
correct,
So-
then you need to pay full price. So
Sounds
the
like fraud
provider,
to me.
the provider has decided that they will just send the food, send lunch for the participants. So now what's happening is the participants are getting this teeny tiny lunch, and the Dane County meal is, a little bit more robust. And so where's my cake, and why am I not getting
So we
peaches? And-
supplement.
well, we can't, because I brought this to the county, and now the county's like, absolutely not. They cannot have the meal program unless they pay full price. So it's
we
really been
don't
ugly.
we don't do carry-ins here.
But and so that's the question is, the county said, well, they can't come to the nutrition site meal, and I said, but they're not. They're coming and sitting and eating their lunch, just like we have an embroidery group that meets like all day on Thursdays. And a lot of the folks just bring their lunch and they're sitting in the back of the dining room. So I can't technically tell anybody they can't bring their lunch and eat at the senior center. I don't think I can. The county is funding that nutrition program at about 35%, 40%. So I can't really say, if you're not dining with the Dane County Nutrition Program, you can't come here. I don't feel like I can say that to anybody. It's a community senior center that's open to the general public. If you want to bring your brown bag lunch and sit in the dining room and eat, I feel like that I need to allow that. What gives me the right to tell people they can't come and eat there and bring their own lunch?
Can you reserve certain tables for the nutrition program
Yes.
and say that if you're, that this area is reserved for the nutrition program?
Yeah, but
Yes.
then they get into
I
the
know.
deal about they want to mix in with
Right.
people,
It's
socialize
been
with people.
it's been a huge headache.
You gotta go over to the bad
Huge.
table.
I know, right? And then the provider is saying to me, well, I don't want them to lose their dignity. And I was like, well, too late. You're bringing them some peaches and a small tuna sandwich, and they don't get cake. They lost, you know what I mean? And then,
Right.
yes,
Is one
like,
of the other issues too, non-residents?
I can't, I don't think I can say. I mean, if I said it to them, then, I mean, we have, probably 30% of our participants are non-Fitchburg residents. Not lunch so much, but
Yeah,
in general,
other things,
so.
yeah.
Yeah,
Okay.
so it's been just a huge headache.
Is
And
that
it will
group home meeting their nutritional requirements for these?
Well, we are looking
know
into that, and in
I
the
looked at
state
one of the
statutes,
meals.
it's very vague. I just had Angela send me that. So I have today I have a director's meeting at the county, so we'll be talking about this. It's just been really hard. So.
Would be
Well, I'm
nice to know
sorry.
some-
I mean, it's
I
not,
just-
And
having worked, worked in the kitchen.
Right,
It's just really,
awkward.
it's very awkward because a lot of times, you're sitting there, you've got the food. You're throwing away some of the food,
Mhm.
and they're sitting out there now. I noticed
Right.
yesterday with her little plastic,
Right.
little thing for her sandwich and her one, and she's surrounded by everybody else at the table.
Right.
Has the whole meal.
Right.
And you just think, oh, this.
It doesn't feel right.
No, yeah.
I know.
I was like ready to pay the $7.95.
Well, it's about $9.40 now, and that,
Oh,
it's really expensive to pay the full price of the meal. I mean, I wouldn't want to pay $9.40 every single day to eat there. People can't afford that, but it's not just the food, it's the administrative, it's the cost of the drivers coming and dropping it off, there's so many other things. So, it's not a closed issue because I feel like Family Care should be reimbursing the county for those meals. Those same participants, if they were getting home delivered, the Family Care would pay the county full price for the meals, but because they're coming to congregate, they don't pay them. And I think that is just backwards. Because you want
That's
to
a
reduce
loophole.
social isolation, you should be paying for them to come to the center and have a meal. But as soon as they get really frail and can't come, Family Care will pay for the meal at home, full price. So they'll reimburse the county, but they will not do it
Oh,
here.
I didn't know that.
It's just, there's so many, this is, again, another huge can of worms that, Dane County is going, oh, wait, maybe we need to talk about this a little more. So we're dealing with it,
Yeah, you are.
we're trying.
Right.
so are other sites having the same issues, I'm guessing?
Only once, and I'll learn more today when the directors get together. I don't know if other sites just completely banned and said, you can't attend because they're just a senior center and maybe they're more funded by Dane County, so they can say this is a Dane County nutrition site, and if you can't come. But again, I don't feel like I can say that to anybody. You can't come here. I just don't think that legally I can and morally I can. But I do feel like we can develop some standards that will help accommodate everybody. And if these folks aren't being attended to, they can't come. And you can't put that on another participant. which is kind of happening. And so I written another letter and made a phone call to the provider to say, this is not fair. So-and-so now has to bring the meals in and make sure the other 2 people are eating. Like, that shouldn't be on her. You need to send a caregiver. So we'll work through it.
I never would have thought that you'd had to worry about somebody toileting themselves.
Yeah, it's not
That's
often,
kinda
or even just, where's the bathroom? Can you take me to the bathroom? Well, no, I can't. We'll consult another staff, and no. As soon as we open that door, then we're in adult daycare.
Yeah.
And there are adult daycares that are perfect for these individuals. So I'll keep you posted.
They probably just cost a lot more.
Correct.
Yes.
That's exactly right. It's not free. So anyway, so if you could please look at that code of conduct, all the stuff you're thinking about, send it via an email, and I'll incorporate it into a draft, and then we'll come up with a good solid plan to update that. So yeah, that was the heavy stuff. I wanted to just pass out information about, you might have seen some information about the Healthy Neighborhood Initiatives, and they're partnering with United Way. And so Wade, who works for planning, is sort of spearheading this. And right now, the partnership with United Way is just to focus on youth. Because my concern was some of those grants that are available now to nonprofits through Healthy Neighborhood Initiatives were going to go away, and it was all going to focus on youth, but that is not the case. So the city still has those grants available for nonprofits to serve whomever, all ages, in Fitchburg. This is a little different. This is a new partnership where they're trying to do some fundraising with United Way, and they are focusing on youth needs. And so I just wanted to bring that to your attention, and so did Wade. So you're aware of that. We do have an agency, the Cultural Diversity Program through Dane County is going to apply for a grant, for a Healthy Neighborhood Initiative grant to expand services for Latino older adults in Fitchburg. So we're sort of partnering with Newbridge, it comes out of Newbridge, to support their application. And then we are looking at doing like a caregiver support group for Latino seniors, kind of focused around grandparents raising grandchildren. I think that grant is due on Monday, so we're working with Newbridge now. So I just wanted to bring that to your attention.
The regular grants are due 17th.
Yeah, which is Monday. Yeah.
Yes.
Yeah. So I know, came quick.
So it's like,
Right. I know. They gotta get moving. So yeah, that's all the heavy stuff. Otherwise, annual report is due at the end of the month. I'll have Dave here next month to kind of go through that. One of our most popular programs, we have over 150 people on a pickleball email list. Pickleball is out of control. They are playing all day Thursday. We have a beginner group on Mondays afternoon, and then most of the time, Dave, if the Oak Hall is open, they play every afternoon. It's crazy, and I know that there's some movement on some new pickleball courts outdoors in Fitchburg, which is so over needed. So anyway, it's kind of fun.
Is that because pickleball is free here and it's not in other places?
Possibly, and we have looked about a drop-in fee, and we're just still throwing that out, because the nice thing about not having a fee is at any moment we can say, sorry, you guys can't meet today, so next Tuesday for voting, sorry, you're out. We don't manage it at all. They just show up. They set the net up. They take it down.
Do they have to bring their own?
They do. We have a couple paddles if you're new, but we don't provide, we don't, right, most people have their own paddles. We provide the net and the balls.
Okay.
If we start charging a fee, I feel like the expectations that we have to provide are gonna go up. Well, you set up we're paying, you set up the net, you know what I mean? And then how do we do it? Is it a drop-in? Because not everybody comes every time. Is it a session? So there's a lot to think about. I do know when we need a new net or new balls, we say, okay guys, can you make a donation? And then boom, they pay for it. I never really have to take any money out of our funds to pay for nets or balls, because they'll donate money. But I'm not against a fee. It's just if it's a drop-in fee, they have to come downstairs because we don't have an office upstairs. Most people won't do that. There's so many little silly things that go along with charging a fee, but I'm not against it. It's just figuring out the best way to do it.
Everything else has a fee.
I agree. I'm not about
Exercise,
giving
yoga.
stuff away.
everything else.
But there's no instructor. There's nobody up there. There's no leagues. We're not coordinating anything. You come, you figure out how you're going to rotate in and out. You figure out how you're going to play. But I think a drop-in fee is a reasonable request. You know.
Just for maintenance of the building?
Correct. The lights are on.
Yeah.
Yeah. So I don't disagree.
Use of the space.
Mm-hmm. Yeah.
Just
And
locks
the
on
fees-
the wall.
That's what I'm thinking.
The fees are so reasonable.
Yeah.
I mean,
Everything we do is so reasonable.
it is.
Yeah. Let's see. Tax help. We had a successful Friday where AARP volunteers come in and probably do
Can
30,
I ask
60.
one question
Oh, yeah.
before we go
Sure.
move on to past pickleball? The new Edgewood
Sports complex.
complex,
Uh-huh.
are they gonna have pickleball courts there?
I don't know. And that's
That
the.
would be
It's not the
important.
high school. It's the college, right?
It's a college,
Yeah.
yeah.
And
I don't know.
I would think that pickleball is not a college thing.
I would say that too, Dorothy.
What do you need for a pickleball court?
Like a tennis court.
Okay.
It's that kind of
It's a
setup, except
smaller.
the net. Yeah, it's a little bit of a smaller perimeter.
A bunch of tape to tape off the court
Okay.
and a net.
Because they do play pickleball. They did tape off one at Swan Creek
Yeah.
for them to play outside. But if they design it, like Stoughton just opened up, like, I don't know, 8 pickleball courts specifically just for pickleball, outdoor pickleball. It's pretty cool. So I'm assuming they're going to design just pickleball courts, not turn the tennis courts into pickleball. They should be separate.
Yeah.
Because the net's a little lower too.
Yeah.
So
There aren't that many people playing tennis, though.
not anymore, not as much. The pickleball's taken over. So.
I think the tennis courts next to the Traceway new building might be.
We have asked about that
Mhm.
a couple times. I think that's a perfect location.
So people can
Yeah.
start mentioning that to appropriate people and say,
Yeah.
it would be nice
Oh,
if.
Yeah.
Mhm.
Sorry,
The,
Bob.
the new building, the new apartment complex is called Highline, the senior apartments. They have a name. They're called Highline. Amy and Sarah went over there a couple weeks ago. It's beautiful. I can't say they're completely full, but they're pretty full. They had a huge wait list, so they were calling everybody on it.
Do they have a pickleball court?
No, they don't have. It's all nothing outside.
They're pretty squeezed for space.
Yeah, they're pretty squeezed over there. I think they're slated to open May 1st. So
Wow.
that is just like 1 month away. So the manager is coming here next week to meet with us so we can just talk about how we can partner. I'm still really concerned about transportation, and I am going to the Transit and Transportation Commission meeting tonight. We do have a representative, Bill Horns, who is on the Friends, who also is an RSVP driver, so he will be serving on that committee. He's actually in Florida, so I'm going to sit in on the meeting tonight. I know they're just looking at the comprehensive plan or something, but I really want to keep this in the forefront because I'm just really nervous about it, how we're going to accommodate.
Now, they have meals over there, or
They
are
do not.
They do not.
No, I think they have an activity room. I think they're going to try to do some exercise stuff, but no meals. They are on a bus line, but of course it will only take them north. It will not bring them down here. So
How many people did you say?
it's 160 units. So there could be some married couples in there. So it's going to make a big impact on us, I think. So we'll see.
Even the parking lot here.
Yeah,
could be
right.
impacted.
Some days I know. We're like, where is everybody coming from? I think that's about it. Lots of stuff going on. I talked about some of the entertainment.
Census.
Census, Dave sits on the committee for the census. We have a lot of good ideas. In fact, he'll be back in March when he does the annual report. He'll report about what we're implementing for census to make sure all older adults are counted. We'll be going into apartment complexes. Social workers can meet with home delivered meal participants and have them do it online. We're going to make sure we have a computer here. We have a connection through the Women League of Voters that we'll look to them to maybe offer times where people can come in and do it online, and then that person can assist. So we've got some good ideas to try to make sure that all older adults are counted, because that does impact older Americans' funds, and so it directly impacts us. So it's going to be really
They
important.
are also looking for including older folks that would like to make a little bit of money helping out.
Oh, I know, how many, yeah, they
There's
need to
about
hire.
a gazillion jobs.
Right, so they're doing a lot of
So
recruitment
they've got
right
all
now.
kinds of jobs, some from office, some from home,
Mhm.
some doing doors, phone calls. There's
Right.
just all kinds of options. So they're saying anybody that has a little extra time would like to make a few extra bucks, go and apply, and I think it's 2020 census.gov.
Yeah, we have some posters downstairs too,
So.
if anybody wants the,
Mhm.
information. So other than that, we have some really cool photographs of the beer line, from.
The beer line.
The beer line that had a big influence on transporting beer on the rail system, and it's from it's really cool. The pictures are really cool. I'm trying to think of the organization. I always forget what it's called. Let's see. The beer played an integral role in the growth of Wisconsin industry while bringing Milwaukee national fame. To shine light on both the Center for Railroad Photography and Art. So they're the ones that contacted us. They did photographs before for us. They curated the touring exhibition, Milwaukee's Beer Line, which narrates the rise and fall and rise again of Milwaukee's beer industry through the eyes of the railroad. So there's a lot of cool photographs downstairs in our hallway, if you're interested. It brings people in and it's kind of fun. So it's a fun partnership. They said we were the only senior center that was willing to do that. So this is a second round of photographs that they brought in that are related to the railroad industry, so pretty cool. So other than that, check out your newsletter, lots in there. I think that's all I got.
I'd say that was a lot.
I know, I know.
You're not being paid enough.
Oh, I am being paid plenty.
For tomorrow's Valentine's Day, you have a trumpet player at lunch,
Yeah,
right?
Verge.
Yeah.
Yep, I think we have 50 plus signed up for lunch, so it'd be a fun day. Yeah.
Any other announcements? Okay, then our next meeting is March 12th at 8:30, and just a reminder, send suggestions on the code of conduct to Jill before then. And do we have a motion to adjourn?
So moved.
Second? All in favor?
Aye.
We are adjourned at 9:45.
Thank you.
Second,
I-